Hello friends, welcome to my YouTube channel MedChap. In the last video, we have discussed about stomach bed. Today we are going to discuss about three topics: blood supply of stomach, lymphatic drainage of stomach, nerve supply of stomach. Let's start with blood supply of stomach. Blood supply means both arterial supply and the venous drainage. Basically, stomach is supplied by the branches of the celiac trunk. First branch is the left gastric artery, which supplies the upper part of the lesser curvature. Second branch is the splenic artery, which gives three branches. One supplies to the spleen, second one supplies to the upper part of the greater curvature, which is the short gastric artery, which gives 5 to 7 branches. Third branch is the left gastroepiploic artery, which also supplies the greater curvature. Then the third branch of the celiac trunk is the common hepatic artery, which gives two branches. One is the proper hepatic artery and the second one is the gastroduodenal artery. Gastroduodenal artery gives two branches. One is the superior pancreaticoduodenal artery and the right gastroepiploic artery, which supplies the lower part of the greater curvature. And the proper hepatic artery give one branches, which is the right gastric artery, which supplies the lower part of the lesser curvature. With this, arterial supply of the stomach completes. Now we will see the venous drainage of stomach. Venous drainage simply means the drainage of the blood that used by the stomach. Here, the first group, short gastric veins from the greater curvature and the left gastroepiploic vein from the greater curvature and the tributaries from the spleen, all the three drains into the splenic vein, and the splenic vein drains into the superior mesenteric vein. Here the right gastroepiploic vein drains directly into the superior mesenteric vein, and the third one, left gastric vein and the right gastric vein drains into the portal vein. Here the splenic vein and the superior mesenteric vein forms the portal vein. Portal vein receives blood from the digestive tract as well as from the pancreas, gallbladder, spleen, and send both nutrients as well as toxins to the liver, where nutrients get used up and the toxins get detoxified. Now we will go through the second topic, lymphatic drainage of the stomach. Basically, the stomach is divided into four segments or the four areas, which is right upper 2/3, right lower 1/3, left upper 1/3, and left lower 2/3. Now we will see lymph from various segments drain to the various lymph nodes, like lymph from the A segment drain to the pancreaticosplenic nodes. Then lymph from the B segment drain to the left gastric nodes, and lymph from the C segment drain to the right gastroepiploic nodes and the subpyloric nodes, and the D segment drains to the pyloric node, right gastric node, and the hepatic nodes, and finally lymph node of all segments drains to the celiac node. Thank you. Now we will see the nerve supply of stomach. Stomach is supplied by both sympathetic and parasympathetic nerves. Sympathetic nerve is derived from the T6 to T10 segment of the spinal cord via greater splanchnic nerves to celiac plexus, then to hepatic plexus, after which they travel along the arteries supplying the stomach. These sympathetic nerves are vasomotor, that means they supply the blood vessel, which help in the dilatation and contraction of the blood vessels. They act as motor to the pyloric sphincter but inhibitory to the rest of the gastric musculature, and they are the chief pathway for the pain sensation from the stomach. Now we will see the parasympathetic nerve supply of stomach, which is derived from the vagus nerve through the esophageal plexus to gastric nerves. Here gastric nerve divided into anterior gastric nerve and posterior gastric nerve, and anterior gastric nerve divided into number of gastric branches and two pyloric branches, whereas posterior gastric nerve is divided into smaller gastric branches and larger celiac branches. These parasympathetic nerves are both motor and secretomotor to stomach. That means its stimulation increase in the motility to the stomach as well as increase in the secretion of the gastric juice, which is rich in pepsin and HCl, and also it is inhibited to the pyloric sphincter. Now we will see anterior gastric nerve supply which part of the stomach. Let's see. Here the anterior vagus nerve starts and gives the first branch, that is the hepatic branch. Then it divides. This one is the gastric branch and this one is the pylorus branch. Pylorus branch supplies to the pyloric region and the gastric branch supplies to the fundus body of the stomach. Here we will see posterior gastric nerve supply which parts of the stomach. As we know, posterior gastric nerve is divided into two parts. One is the smaller gastric branches and the larger celiac branch, which supplies to the celiac plexus, and the smaller gastric branches supplies to the fundus body of the stomach and the pyloric antrum. And here the anterior nerve of lateral jet and the posterior nerve of lateral jet both supplies to the pylorus. And one more thing, the solid lines suggest that it is the anterior nerve supply, and this dotted line suggests the posterior nerve supply. With this I conclude the topic. Thank you.